So good evening, everyone. I hope you all are doing very well. So all of my lovely students, so we will be starting with the PYQ and PYT edition series at our channel. And beta, we will try to finish everything in next 6 to 7 days. We will take all units one by one. So today, as the first step, I'll be taking general pharmacology. And in this section, beta, we will only discuss those questions which have been asked in the previous 5 years. We will not be taking any other question because it will create a burden for you. Namaste, everyone. Good evening. So we will only take the PYQs, okay? The questions which have been asked. We will be very specific. We will finish our session very fast also because you have other subjects to do also, okay? So without wasting your precious time, let's start all the questions which have been asked in the past 5 years. So today we will be starting with the first unit, that is general pharmacology. Okay. So let's go very fast. So what is the meaning of PK value of a drug? So PK value, let me explain you. If you put a drug in a media and that media has a particular pH, and you saw that in this pH of media, the drug becomes 50% ionized and 50% non-ionized. Then this pH of the media becomes PK value of a drug. So can we say PK value is that pH at which a drug is 50% ionized, water soluble, and 50% non-ionized. So I think our option B is correct. Go with the option number B, cram it now. Next question. Which of the following drug causes iron trapping inside the stomach cells, which leads to peptic ulcer? Remember one concept. Any drug which is an acidic drug can trap inside the stomach cells. Any acidic drug can trap inside the stomach cell. Out of these four options, we are very much confident that aspirin is an acidic drug, because another name of aspirin is acetyl salicylic acid. And remember, for the treatment of any type of peptic ulcer, whether it is aspirin induced, whether it is H. pylori bacteria induced, whether it is because of a tumor Zollinger-Ellison syndrome, any peptic ulcer, always the drug of choice will be PPI, that is proton pump inhibitor, ending with the word prazole. Any PPI. So if I'll ask you aspirin induced peptic ulcer, give prazole wale drug. Now, this is a tough question which was asked in INICET and NEET exam, that which of the following drug, yes, this video will always be available to you, okay? So I'll not remove anything, don't worry about it. But it's better that if you can see right now. The reason is, if you have any doubts in your mind, any question comes in your mind, you can ask me right now. So I'll be very happy to answer, okay? So which of the following drug is a inhibitor of ATP binding cassette? ATP binding cassette. Yes, the answer for this question is verapamil. Now remember, ATP binding cassette is another name of a transporter known as P-glycoprotein. And nowadays questions are very well coming on P-glycoprotein. So let me explain you what is P-glycoprotein. So P-glycoprotein is a transporter which will take this drug which is absorbed. Suppose the drug is getting absorbed into the body, it is crossing cell. P-glycoprotein, it will again hold the drug and it will throw outside. So can we say another name of P-glycoprotein will be an efflux transporter? Efflux means it is again throwing outside, and this P-glycoprotein does not work freely. It requires ATP, so it is attached with an enzyme which will take out ATP from the cell, utilize ATP from the cell. So that is why another name of P-glycoprotein is ATP binding cassette. Cassette means any transporter or protein. Now remember, the P-glycoprotein is a enemy of a drug. Remember, it's an enemy of a drug. It does not want a drug to remain inside the body. So keeping this statement in mind, Can we say, if we see the locations of P glycoprotein, if I say it is present in GIT, can we say it will not allow a drug to enter? So it will decrease absorption of a drug. That means it will decrease BA. BA stands for bioavailability of a drug. Less drug will be available. And if I say it is present in kidney and liver, it will increase the excretion of the drug out of the body. So it will increase urinary and biliary excretion. It is also present in barriers around organs, barriers like blood-brain barrier, placental barrier, and it will decrease the entry. And cancer cells become resistant to a drug by expressing P glycoprotein on their surface. Again, it will throw the drug out of the body. Do you agree with this part? So any drug which is identified by the P glycoprotein, which you call it as substrate of P glycoprotein, yes, a drug used in heart failure, digoxin, don't forget, you can't afford to forget this drug. Now there are certain drugs which increase the activity of P glycoprotein. We call them as P glycoprotein inducer, which increase the activity. A TB drug causing red color urine, Rifampicin, is a P glycoprotein inducer. Similarly, we have drugs which are P glycoprotein inhibitors, which will reduce the activity. You can make a mnemonic. One student has already answered. That's pretty good. That's pretty good. That's pretty good. Quack. Now, in this quack, try to remember verapamil, one, and try to remember clarithromycin because it has been asked. So, can we say verapamil is a inhibitor of P glycoprotein? Agreed? And can we say that if we combine rifampicin with digoxin, it will decrease the effect of digoxin because it will increase the excretion into the urine. Similarly, clarithromycin, if combined with digoxin, it will increase the toxicity of digoxin, which was recently asked question. So tell me the answer of this question. This question was of INICET exam. That which of the following drug increase the risk of digoxin toxicity? So the answer was clarithromycin, and the reason you student will say, because it's a P glycoprotein inhibitor, digoxin will not be excreted out into the urine. All you agree with this point? Now one additional question asked in your NEET exam, just write this statement that there is a drug known as cyclosporin. Cyclosporin is also an inhibitor of P glycoprotein. And because of inhibition of P glycoprotein, cyclosporin has a side effect of cholestatic jaundice. It has a side effect of cholestatic jaundice. The reason is, I'll tell you. Remember, any harmful molecules in our body are also excreted by P glycoprotein. So liver excrete bile out of it with the help of P glycoprotein. Can we say if we give cyclosporin, it inhibits P glycoprotein, there will be intrahepatic bile accumulation. It may lead to intrahepatic cholestatic jaundice. So remember this statement for the last minute. Cyclosporin causes cholestatic jaundice by inhibiting P glycoprotein. I hope it's perfectly clear to everyone. Now let's talk about a simple question which was recently asked in your NEET exam and FMGE also, that in which route a drug undergoes first pass metabolism in liver. The answer of this question is oral route. The reason is very simple. If you take any drug orally, the drug first comes into portal vein. From portal vein, the drug first reaches to the liver. From liver, inferior vena cava is produced, and then the drug reaches to the heart. Agreed? If a drug reaches to the heart will distribute the drug to the whole body. So this is known as BA. BA is bioavailability of a drug, that how much amount of drug is reaching to the heart. So in between we have liver. Liver identifies this drug as a foreign substance, and before it can reach to the heart, liver degrades this drug, and this property is known as first pass metabolism in liver. So the answer is oral route. Let's move ahead. False about Z-track technique. So Z-track technique is given in intramuscular route. The answer is absolutely true. So when you give any injection into the deepest layer of the muscle, deepest layer of the skin, that is muscle. Because first skin we encounter epidermis, then we encounter subcutaneous fat, and the deepest portion is muscle. So we give an injection by 90 degree. When we withdraw the needle, a drug can extravasate or come out of a muscle, and it can deposit in subcutaneous fat. And if the drug has a color, it can lead to staining of subcutaneous fat. So, intramuscular Z track technique is given so that we can create a zigzag track. A drug does not or not able to come out into the subcutaneous tissue. So, why we give? We give Z technique to avoid staining of subcutaneous tissue. Is it given to reduce pain in injection? The answer is no. This is a false statement. There are sensory nerves already present inside the muscle. How would you be able to reduce? No. And the examples of the drug given are very important: iron and antipsychotic drugs. They are given by intramuscular Z-track technique because iron has a brown to black color. If we will not give it, will lead to staining of subcutaneous tissue. Okay, that's great. Similarly, antipsychotic drug, because psychotic person will not take your oral drug, he does not believe that he or she is suffering from a disease. So you have to forcefully call that patient and give intramuscular long-acting injection of antipsychotics. So which of the following drug is not used as a transdermal patch? This question also came. And the answer of this question is A, promethazine. So promethazine is a drug given in motion sickness, but it is not given as a transdermal patch. Okay. So you have to remember the list of the drugs which are available as a transdermal patch. The question comes very commonly. Okay. So if you talk about nicotine patch, it is given for smoking de-addiction, because if small amount of nicotine continuously enters into the blood with transdermal patch, you won't be having craving for smoking. Hyoscine, scopolamine, remember a trick. These drugs are ending with the word amine and amine. Any drug which is ending with the word amine are only given in as a transdermal patch in motion sickness. Promethazine, a drug for motion sickness, is not ending with the word amine. It is ending with the word zine. Nitrate for long-term treatment of chronic angina. Clonidine patch is the only patch available for the treatment of hypertension as a patch. Selegiline is the only drug which is available as a patch for the treatment of depression. Rivastigmine is the only patch which is available for the treatment of Alzheimer's disease. This was a recent question. And rotigotine patch is available for Parkinson's disease. Although in the market we have more than 100 types of drugs available as a transdermal patch, it is impossible beyond human capability that you can remember them. But these are the drugs which are repetitive question. We won't think it will come out of it. So let's move ahead. So which route has 100% bioavailability? A simple question. The route is intravenous route. Because when you give a drug into a vein, when you give a drug into a peripheral vein, whole amount of drug will reach to the heart. Because in a vein, when you are giving an injection into a vein, there is no cellular barrier. So if you have loaded an injection of 100 milligram, how much drug will reach to the heart? 100 milligram. How much will be available to our body? That is 100% available in the body. While any other route, there is some sort of cellular barrier. Let's say oral route, transdermal, drug has to cross cells. That is why drug is less absorbed. So remember, intravenous. So this is a very repetitive question. Rate of absorption on concentration time graph, it is represented by, remember beta trick. Wherever the word rate come, if you remember 11th and 12th class, rate always means time. Rate always means time. So which is the correct answer? You can figure it out right now. The answer is T max. The answer is T max. Okay. Rate always means time. Now let's understand. Let's imagine you have taken a drug orally. When you have taken a drug orally, the drug will come into your plasma slowly and slowly with time. So this graph is known as concentration time graph. A drug comes into the plasma slowly and slowly. So we obtain this graph. This is how the drug is entering into the plasma with time. This peak point, it is known as Tmax, at what time it is coming. And it is coming in which concentration, it is known as Cmax. And this total area is known as AUC, area under the curve. Remember, rate means whether the drug is coming slowly or the drug is getting absorbed very rapidly. So this speed of absorption or rate of absorption is depicted by Tmax. Cmax, it tells you about the maximum plasma concentration which is achieved. And AUC tells you about total extent of absorption. Total extent of absorption means that this much amount of drug is coming into the plasma in this much amount of time. And a follow-up question, this AUC, it is used to calculate bioavailability of a drug, that how much amount of drug is finally entering into the plasma with the time, which is bioavailability. Out of these three parameters, remember, bioavailability is calculated by which parameter? AUC, which is area under the curve. Next question, a factual question. Hemodialysis is not effective in poisoning of. So this is the list in which we do hemodialysis. The mnemonic is BLAST. So first let's see this mnemonic. First is phenobarbital. Yes, we do hemodialysis. Lithium. Yes, we do hemodialysis. Alcohol. Yes, we do hemodialysis in their poisoning. So the answer of this question is digoxin. So in digoxin poisoning, we don't do hemodialysis because digoxin has a very high volume of distribution. High VD means the digoxin will not remain in blood. High VD means the digoxin will enter into the tissue and deposit there. So any drug which deposits in tissue, that means high VD, will not be found in blood. So there is no role of filtration of blood or hemodialysis. I hope it's perfectly clear. Agreed? So you just have to remember the marked question I have told you, this one. Okay, aspirin is also asked. Next question, which drug causes bullseye maculopathy? Beta, bullseye is known as shooting board, which you see in sports. Shooting board is there like this, or target or shooting board. Target or shooting board is known as bullseye. So you can see this black color. So remember, the answer of this question is chloroquine. Anti-malarial drug causes target-like deposition or bullseye maculopathy. One follow-up question. Chloroquine among all drug has highest volume of distribution. Its volume of distribution is more than 15,000 liters of plasma. In simple word, high VD means it deposits in all organs including retina, which will cause bullseye maculopathy. It can lead to permanent blindness. Next question, thiopentone exhibit redistribution phenomena because. Now remember, the answer for this question is highly lipid soluble. Now what does it mean? Remember, thiopentone is a general anesthetic drug. Do you agree with this part? It is given as an inducing GA to make a person unconscious. So let's say you have given thiopentone to the patient. Thiopentone, first it will enter into the brain because brain has a very good blood supply. Agreed? And the person in 2 to 5 minutes will become unconscious. It will become unconscious. Now when thiopentone will come out of the brain, remember what happens to most of the drug. Most of the drugs, they are eliminated in urine. Most of the drugs, they are eliminated into the urine, and because of elimination into the urine, the action of a drug is over. Action of a drug is over. Do you understand? Do you agree with this statement? Yes, most drugs are eliminated into the urine and action is over. But in case of thiopentone, this is the exception. In case of thiopentone, thiopentone is not eliminated into the urine because thiopentone is a highly lipid soluble drug. It will not go in the watery media or urine. Thiopentone rather enters into the fat again. From brain, it enters into the fat. Entering into the organ is known as distribution. So can we call this process as redistribution into fat? Because of this reason, action of thiopentone is over inside the body because it gets deposited in fat. This phenomena is known as redistribution. I hope now you are clear with this concept of redistribution. Now, which of the following is a prodrug? Very frequently asked question. Beta, this is the list of the drugs which are prodrug. Okay. So there is one drug we can write above to make the mnemonic, prednisone. So the mnemonic is plasma CCD. So plasma CCD is the list of prodrug. Now remember, all ACE inhibitors are prodrug. And all ACE inhibitor they end with the word pril, except two ACE inhibitor which are not prodrug is captopril and lisinopril. So this question comes very commonly that captopril and lisinopril are not prodrug. So here captopril is not a prodrug, absolutely right. Lisinopril is also not a prodrug. But if I say enalapril, yes, enalapril will be a prodrug. Enalapril will be a prodrug. I hope you are understood with this concept. So remember the name Capto and Lisinopril. Now, which of the following drug? This was a question, I think it was asked last year in NEET exam, that which of the following drug is not metabolized by plasma esterase enzyme? Oh, sorry, only plasma enzymes. Do you agree? Now remember, in our plasma we have certain enzymes which degrades drug or metabolize drug. The first plasma enzyme we have is esterase enzyme, which you have to remember. And the second plasma enzyme you have to remember, the big brother of esterase, let's make it as pseudocholine esterase. Pseudocholine esterase enzyme. Okay. Now the esterase enzyme in plasma degrades a beta blocker ismolol. It degrades a beta blocker ismolol. That is why ismolol is one of the shortest acting beta blocker. Then we have a calcium channel blocker, clevidipine. It's a calcium channel blocker. LOL is coming, so it will be a beta blocker. And it also metabolizes one opioid, remifentanil. Fine. It also metabolizes remifentanil. That is why these drugs are the shortest drug in their respective classes. But we have a drug which metabolized by pseudocholine esterase, that is succinylcholine. Choline word is coming. And another drug you have to remember is mivacurium. These are skeletal muscle relaxants. And one of the shortest acting skeletal muscle relaxant is choline wala succinylcholine. So here the answer, you all are absolutely right, is cis heterocurium. Remember, cis heterocurium does not require any enzyme. It does not require any enzyme to get metabolized in plasma. Do you agree with this part? This process of spontaneous, apne aap, on its own, metabolism or inactivation, which is seen in cis heterocurium, is known as Hoffman elimination. It is known as Hoffman elimination. Fine, that's great. You're absolutely right, Anupji. Very good. Now, recently we have made a new drug which is even shorter acting than ismolol. Till now, ismolol was the shortest acting drug, metabolized by esterase enzyme. Half-life was 10 minutes. But now we have another beta blocker metabolized by pseudocholine esterase, landiolol. And this landiolol has a half-life of just 4 minutes. So which of the following, now it's a potential question not asked till now, but it's a new question. Landiolol, 4 minutes shortest beta blocker. Now clopidogrel is converted into active form by, so let's write this name, clopidogrel, CLO, clopidogrel. Okay, so you can see CL word is coming. So it's asking which enzyme. So we'll write CYP2 C19 enzyme. So you can make like this. C, L word is coming, C and one word you have to identify. And just remember, O word is coming. Avoid clopidogrel with omeprazole. Avoid clopidogrel with omeprazole because omeprazole is an inhibitor of CYP2C19. So with which proton pump inhibitor we can combine clopidogrel? We can combine with P, next word is P, pantoprazole. So avoid giving with omeprazole. So pantoprazole as well as rabeprazole, which is another point we are writing additionally. These two PPIs, they have least CYP inhibiting action. And if either of them is asked, then go with rabiprazole overall least CYP inhibiting action. Next question, which of the following is a CYP enzyme inducer? So before exam, go and see the list of CYP inducer and inhibitor. Only the common drugs which are repetitive, only they are asked. Rare question will not come out of it. So remember, CYP enzyme inducer, the mnemonic is GRAS with the 2A and 2S. Among them, alcohol and smoking, daru and sutta are inducer. TB wala drug rifampicin is an inducer. Anti-epileptic drugs are inducers. Okay, this you have to remember. So can you tell me which of the following is a potent enzyme inducer? We all know the answer is rifampicin. How we can remember? Rifampicin is a CYP enzyme inducer. It was also a P-glycoprotein inducer, if you remember. It was also P-glycoprotein inducer. I hope we all remember that part. Among inhibitor, try to remember the first four coke. But nowadays, even ritonavir is a commonly asked question. Ritonavir, remember, is an HIV drug, anti-HIV drug, protease inhibitor. It is a potent enzyme inhibitor. So all anti-epileptic drug are inducer except which one? Valproate is a CYP enzyme inhibitor. Rest all anti-epileptic drug, phenytoin, carbamazepine, phenobarbital are inducer. Chronic alcohol inducer, acute alcohol inhibitor. So first inhibit, then induce. Isoniazid, a TB drug, is an inhibitor of all CYP except CYP2E1. So no question, I believe, will come out of this among inducer and inhibitor. Okay. So let's talk about a female patient on oral contraceptive pill. It was a recent question of last year, was diagnosed with tuberculosis. She was started on anti-tubercular therapy and now she has been advised to use an additional method or additional barrier method of contraception. What could be the reason for this? What could be the reason for this? Remember, the answer is when a female is taking estrogen or OCPs. Estrogen or OCPs in the body, they are degraded by CYP enzyme. With CYP, the most common CYP which degrades all the drugs are CYP3A4. Now she is suffering from TB, and in TB we give rifampicin, and rifampicin increase the activity of CYP enzyme, which leads to rapid degradation of OCPs or estrogen. So can we say if we combine rifampicin, it will lead to contraceptive failure? So yes, now you know the answer very well. That's great. So remember, it is a very potential question. It might be asked again also, but it's a very simple question. Okay. So if you know the concept. So all of the following drug can cause SLE-like syndrome except. Remember, SLE-like syndrome is caused by ship drugs. Mainly ship drugs. And among ship drug, S stands for sulfonamide, hydralazine, which is a drug for hypertension. Sulfonamide is an antibiotic. A TB drug, isoniazid. P for procainamide, which is an antiarrhythmic drug derivative of sulfonamide. And D for one leprosy drug, Dapsol. Okay, they cause ship drug. They are ship drug. And remember, ship drug in our body, they are degraded by a process known as acetylation. They are degraded in the body by a process known as acetylation. So I hope now you can mark the answer as B. Okay, you can mark the answer as B. Next question. Alkalinization of urine is done in the poisoning of. Remember one rule, beta. What I'm saying, just hear it. In acidic drug poisoning, we turn the pH of urine alkaline, because in alkaline pH of urine, acidic drug becomes more water soluble. Water soluble drug will be excreted out in urine. So turn the pH of urine opposite. Similarly, if I say there is a weak basic drug poisoning, turn the pH of urine acidic. In acidic drug poisoning, turn the pH of urine alkaline. How to do? In acidic drug poisoning, to turn the pH of urine alkaline, gives sodium bicarbonate. And in basic drug poisoning, to turn the pH of urine acidic, this is even more important, we give ammonium chloride. So we all know aspirin is an acidic drug. So in aspirin, poisoning gives sodium bicarbonate, turn the pH of urine alkaline. But recently, paracetamol or acetaminophen was asked. Although it is a brother of aspirin, smaller brother of aspirin, again a pain reliever drug, analgesic drug. So all pain relieving drug, NSAIDs drug, they are acidic drug. So this part you have to remember. Now, remember any drug that ends with the word "ene" will be a basic drug. Amphetamine, morphine, atropine and quinine. So in this case, we will give ammonium chloride. Fine. So what is the answer of this question? Alkalinization of urine is done in ene word is coming. Don't give. So the answer is acetaminophen. So remember, antidote of aspirin poisoning overall sometimes are sodium bicarbonate. If it is still not relieved, do hemodialysis. And antidote of amphetamine poisoning is ammonium chloride. So we give ammonium chloride in cases of amphetamine poisoning. Antidotes are important. Now let's talk about true statement about first order kinetic and zero order kinetic. So beta, let me give you a trick. Although we are at last minute of our revision, there is no point of going into very much concept. So let me give you a trick. There are two order of kinetic by which a drug is removed out of the body. Okay, eliminated out of the body. First order kinetics of elimination, zero order kinetic of elimination. Now, this word in simple meaning, it means that by what speed the drug is eliminated out of the body. Order of kinetic means how fast the drug is getting eliminated out of the body. That depends upon the power of our body. The power of our body is known as clearance capacity. So clearance capacity will determine by what speed the drug will be eliminated out of the body. So remember, the people who come first, they have very good power. So clearance capacity in first order kinetic is very high. And the people who come who are zero, they have very low power in them. So zero order kinetic means very low capacity, which is also known as saturation kinetic because capacity becomes saturated. Now remember one trick. In first order kinetic, as you will increase the dose of a drug, more drug will be eliminated. So as you will increase the plasma concentration of the drug, more drug will be eliminated and the half-life of a drug will remain constant. But this thing will become opposite in zero order kinetic. The elimination of a drug will not increase even if you will increase plasma concentration because the power of the body is very weak. A drug cannot eliminate higher amount of a drug and the half-life of a drug will keep on increasing. The drug will remain in the plasma for long duration of time if we give higher plasma concentration. So these things becomes opposite in first and zero order kinetic. So plasma concentration in the left side will become constant and here constant will become directly proportional to plasma concentration. Remember this part. So now you can mark the correct answer. So the answer is in first order kinetic, the answer is D. Elimination is directly proportional to plasma concentration. A constant amount, half-life increases rate. These are the properties of zero order kinetic. So question is asking first order, go with the D option. Next is at toxic dose, zero order kinetic is seen with which drug? So I have already given you a mnemonic of all the drugs which show zero order kinetic. But for your exam, remember zero order kinetic is mainly seen with three drugs. Although I have given a mnemonic WhatsApp, 8-9 drugs which can show zero order kinetic. For exam, remember three drug: alcohol, theophylline and phenytoin, ATP. So these three drugs, they show zero order kinetic. Remember three drugs, okay? So the answer is this one. Additional question, just for the last minute. Alcohol shows pure zero order kinetics at any dose, while phenytoin can show zero order as well as pseudo zero order kinetic. So alcohol shows pure zero order kinetic, phenytoin shows pseudo and pseudo zero order kinetic. Next question, maintenance dose. Now remember, very likelihood from past 3-4 years, one question is always coming on formula of either loading dose or formula of maintenance dose. Okay, I'll give you a trick how to remember. First dose we will write as loading dose. It is the initial dose or the first dose you give to your patient. Second is to maintain the plasma concentration. You give maintenance dose. Do you agree? Now beta focus on this part. Loading, maintenance. Okay, only this word. Loading लिखेंगे equal to volume of distribution into target concentration which you want to achieve in plasma. Maintenance, clearance capacity of the body into target concentration which you want to achieve in plasma. Now how to remember? In loading beta, just see this part. In loading you are having D word. You are not having any C word. Go with D, volume of distribution. While in maintenance, you are having C word. You are having which alphabet? C alphabet is coming. D word is not coming. Go with the clearance capacity. Okay. So it's a trick how you can remember, but a follow-up question. Here the answer is, now we know maintenance dose will be the option number B, clearance into plasma concentration. But remember, these are the formula of loading dose when we give, or maintenance dose when we give a drug by IV route. Okay. Now, if you want to give a drug by any other route, let's say oral route, if you want to give a drug by oral route, divide them by BA. Divide them by BA. BA stands for bioavailability. So if you have been asked to tell me the formula of loading and maintenance dose by oral route, then you have to divide the formula by bioavailability. Do you agree with this point? I hope you will never forget it. Okay, let's move ahead. So this year INICET question, why I'm repeating it, because these questions are repeated in your NEET and FMGE also. This year in INICET May exam, question was asked, tell me 3 parameters on which loading dose of a drug depends. This question came. Can we say loading dose of a drug depends upon volume of distribution? It depends upon your target concentration. And the third parameter on which loading dose depends upon is bioavailability. Okay, it is bioavailability. Now, the clearance of a drug and VD of a drug is 1.386 and 80 liter. What is the predicted half-life? Remember, the third formula you have to remember is the formula of half-life. The formula of half-life is 0.693 volume of distribution divided by clearance capacity. Do you agree? This is the formula. Now remember, for your exam, instead of taking 0.693, it will take your lot of time to do calculation. To save your time, take it 0.7. Take it 0.7. Always in exam, you will come to the nearest possible answer very fast. Do you agree? Now, clearance is given as, and VD is given as a 80 and clearance is given by 1386. Okay, 1386. So can we say the double of 0.7? Double of 0.7 is around 1.4. Double of 0.7 is 1.4. So can we write it as 2 here? Agreed? So the answer will be 2 into 8. 8 will come out to be 40. So your answer will be 40. So remember, I'm not telling you to solve this question. I'm giving you a trick that what you should do in your exam. That is more important. Okay. So take it as 0.7. So time required to reach steady state concentration after the dosage regimen depends upon. Now remember, if you have stopped the drug, elimination takes 4 to 5 half-life. So complete elimination takes 4 to 5 half-life and the action of a drug is over. And the action of a drug is over after 4 to 5 half-life. Similarly, if you have started a drug, its steady state concentration, steady means if you keep on giving a drug, after one point it will become steady. Its steady state concentration is achieved in again 4 to 5 half-life and the action of a drug starts. So don't you think such a beautiful concept? You stop a drug, after 4 to 5 half-life, action is over. You continuously give a drug, its steady state concentration is achieved in 4 to 5 half-life, and the action of a drug starts. So tell me, steady state concentration of a drug depends upon, steady state concentration of a drug only depends upon half-life of a drug. The only factor which determines steady state concentration is half-life. Now, which of the following drug is not a suicide inhibitor? Remember, what do you mean by suicide inhibitor? Suicide inhibitor means any drug which inhibit an enzyme in our body. In which fashion? In reversible or irreversible fashion. It inhibits an enzyme irreversibly is known as suicide, because now this enzyme is dead. Why? Suicide. And irreversibly always means, beta, which bond? It means covalent bond, because covalent bonds are not broken down. Ionic bonds are broken down in water. So that is a permanent bond. Suicide inhibitor, they are also known as, remember, hit and run drug. So why these drugs are important? Even if you stop the drug, their action will not be over in the body. So remember the mnemonic ROMA. Remember a mnemonic ROMA, examples of suicide inhibitor. The first drug is ritonavir. It's an anti-HIV drug. It inhibits protease enzyme in HIV virus. In which fashion? Irreversible fashion. Then you will write omeprazole and all PPI, all proton pump inhibitor. They inhibit proton pump. H plus is known as proton. So proton pump is known as hydrogen potassium ATPase inside the stomach irreversibly. MAO inhibitor, I don't think it will be asked nowadays. And the third drug is very important, aspirin. Aspirin inhibit COX enzyme or cyclooxygenase enzyme. In which fashion? Irreversible fashion. So remember, the answer of this question was, when it was asked, atorvastatin. Remember, statins are cholesterol lowering drug. They inhibit HMG-CoA reductase enzyme, which we will be discussing later on also. And this HMG-CoA reductase enzyme, can you guess now? Statins inhibit HMG-CoA reductase enzyme irreversibly or reversibly? They are reversible inhibitor of HMG-CoA reductase enzyme. Other drugs are irreversible inhibitor. Next question. A drug binds to the receptor and causes no change in basal activity. This question came. It is known as, now remember one trick, any drug which produce effect, any effect, it is known as agonist. And if there is no effect, no change in effect, it is known as antagonist. So this is their exact definition. Now tell me the answer. Tell me the answer. Tell me the answer. Yes, the answer is neutral antagonist. So beta, this graph was asked recently from you. Okay, suppose this is the basal activity. Let's say the heart is beating at 70 beats per minute. Okay, you gave a drug, heart rate rose to 200 beats per minute, which is the 100% effect, maximum effect produced by the maximum effect, which can be generated in our body. We call it as full agonist. If let's say the heart rate only rose to 150 beats per minute, can we say it is not the maximum effect produced? So can we say it's a partial effect produced? So if any drug produces a partial effect, we call it as partial agonist. And if the heart rate falls below, let's say 30 beats per minute, can we say it is producing opposite effect? We call it as inverse agonist. So remember, a full, partial, inverse. These are the three types of agonist we have. And agonist is any molecule which produce effect. Now what about antagonist? Antagonist is any molecule which will not produce change in basal activity. So if you give a drug and the heart rate does not change, heart rate remains 70 beats per minute, it does not change, then we call it as a neutral molecule or antagonist. Okay. Now let's talk about Sugamadex. Sugamadex, it's a new drug that reverses the action of one skeletal muscle relaxant. Remember, all muscle relaxants, they end with the word curare, curium, curonium. So rocuronium is the skeletal muscle relaxant. It appears to interact directly with the rocuronium molecule. Okay, it directly binds to rocuronium and neutralize it. Any molecule which directly binds and neutralize a molecule is known as chemical antagonist. It is known as chemical antagonist. The answer is chemical antagonist. I hope you have understood. So any molecule, let's say A, it directly binds with B and chemically neutralize or inactivates is known as chemical antagonist. Now, there is a molecule which produce opposite effect, of a molecule. We call it as physiological antagonist. It is known as physiological antagonist. And any molecule which block the receptor of a molecule, it is known as pharmacological antagonist. I hope the definition and the concept of antagonist is clear. Now, this pharmacological antagonist, how it is blocking a receptor? It can be competitive antagonist, by competitively block it, or non-competitive antagonist. So these are the various types of antagonists we have. Now you can see the question again. It directly interacts with rocuronium. Because it is directly interacting, we will go with the chemical antagonist. I hope it's perfectly clear. So tell me now the answer of this question. Okay. So this is a follow-up question. It is not asked from you, but to test your knowledge, I have incorporated this question. Histamine causes bronchoconstriction, while salbutamol produce bronchodilation. Can you tell me which type of antagonist they will be? Can you tell me which type of antagonist? Yes, this is an example of physiological antagonist. Because histamine, when acts on H1 receptor, produce bronchoconstriction. Adrenaline acts on beta 2 receptor, produce opposite response, bronchodilation. One follow-up question of physiological antagonist, which was asked in your exam recently. Prostaglandin I2 versus thromboxane A2. Prostaglandin I2, I word is coming, it inhibit platelet attachment. Thromboxane A2, name itself is a thrombus. It causes platelet aggregation or platelet attachment. Don't you think they are opposite of each other? Prostaglandin and thromboxane A2 are opposite of each other. Again, the example of physiological antagonist. Okay, histamine ADR, PGI2, thromboxane A2. Now, true about competitive antagonist. So let me tell you again. I'll come back to this question. Remember, when you give any agonist, okay, and in dose response curve there is a parallel rightward shift. Agar dose response gets rightward shift, this is a competitive antagonist. Because agonist can overcome the effect of competitive antagonist by increasing the dose. And if this graph gets downward shift, this is non-competitive antagonist. Do you agree with this part? Agreed? Yes, insulin glucagon is also a physiological antagonist. So can we say what happens to dose response curve in competitive? Rightward shift. Non-competitive, downward shift of dose response curve. Remember, the maximum effect produced by the drug is Vmax. Can we say in cases of competitive antagonist, Vmax will remain same? While Km is the dose of agonist you require will be higher. While in non-competitive, you cannot produce same level of response ever again. So Vmax will reduce, Km will remain same. Okay. So this is a very important graph for you. Difference of competitive and non-competitive. So symbol of dose and response are Km and Vmax respectively on dose response curve. So don't be afraid of symbols. Km means dose, Vmax means response. Now next is, which of the following provides information about the largest response produced by the drug regardless of dose? Anyone? Yes, Avigdas, uncompetitive is never asked. Yes, but you are absolutely right. So remember one mnemonic. help. Help. So on this dose response curve, height means efficacy and left sided means potency. ठीक है? The answer of this question is efficacy. Efficacy means maximum response produced by the drug, irrespective of dose. Potency means dose required to produce 50% of response. And on dose response curve, remember height means efficacy, left sided means potency. Agreed? Height means efficacy, left sided means potency. Fine. Now therapeutic index is a measure of, remember therapeutic index is equal to TD50 upon ED50. That is toxic dose in 50% of people and effective dose in 50% of people. Sometimes instead of TD50 we also write LD50 upon ED50. That is lethal dose in 50% of people. In 50% of the people. So this is the margin between effective dose and toxic dose. है ना? Effective dose and toxic dose. So this ratio will tell you the safety margin of the drug, that how much drug is effective and how much drug is toxic. So remember therapeutic index, it tells you about the safety margin of a drug. It tells us about the safety margin of a drug. Next question. LD50 is, tell me, LD50, yes, follow-up question, last year question. Median lethal dose in 50% of the people. Next is, all of the following agents act by intracellular receptor except. Now, remember, thyroid hormone, vitamin D receptors are cytoplasmic receptor which are present inside the cell. Thyroid hormone are nuclear receptor. Steroids are also cytoplasmic receptor except estrogen. So intracellular receptor can be of two types, nuclear or cytoplasmic. So the answer of this question is insulin. Insulin acts on a receptor which is present on cell membrane, and the receptor of insulin is tyrosine kinase receptor. The receptor name is tyrosine kinase receptor. Last year MCQ, growth hormone prolactin, cytokines, and very important leptin. Last year question leptin. Their receptor are JAK-STAT receptor. JAK-STAT receptor. Last year question leptin. Okay, satiety hormone in the brain. Great. GQ type of GPCR receptor acts by activation of. Remember GPCR means G protein coupled receptor. G protein coupled receptor. It is of three types, GQ, GI, GS. Remember GI and GS, they act by either increasing adenylyl cyclase level or they act by inhibiting adenylyl cyclase level. Agreed? GQ type of GPCR, which is the question, it acts by phospholipase C activation. Guanylyl cyclase, it is activated by a gas in our body, nitric oxide. And tyrosine kinase receptor, we have just discussed insulin, and IGF, which is insulin-like growth factor. Insulin-like growth factor. Very good. Next is, phase 1 trial is not done for. I'll give you one statement. Phase 1 clinical trial is done in healthy human. Now, can you tell me the answer of this question? Phase 1 clinical trial is not done for. I am telling you, we test the drug in healthy human. So tell me the answer. In healthy human, can we find pharmacokinetic of a drug? How it is given? What is the volume of distribution? What is the loading dose? We can identify the safety limit of a drug. That what is the maximum tolerable dose? Yes. We can also see the toxicity of a drug or safety. So can you identify efficacy of a drug? Whether the drug can treat a disease or not. If you want to find efficacy of a drug, remember, efficacy is identified in patients. Phase 1 clinical trial is done in healthy human. Another follow-up question, tell me the answer. Phase 1 trial is mainly done for. Phase 1 trial is mainly done for. All four options are same. Tell me the answer. Out of these four options, if all four options come, phase 1 clinical trial is mainly done for. Tell me the answer. MTD. Mainly done for MTD. Can you tell me now what is MTD here? Phase 1 trial is mainly done for maximum tolerable dose. Okay, maximum. No, it is not safety. The reason is we never leave the hand of safety in any phase of clinical trial. But maximum tolerable dose, it is an exclusive component of phase 1. It is only done for MTD. Okay, good. So let's make a very fast summary. Phase 1 trial, phase 2, phase 3, phase 4. Names are written in front of you. What you have to identify, how it is done. Phase 1, 20 to 50 people. Phase 2, 200 to 500 people. Phase 3, 2000 to 5000 people. So don't you think the number of people are increasing? After phase 3, the drug comes into market. Phase 4 is done after market approval of a drug. That is why this name is asked post-marketing surveillance. Now the people are taking your approved drug. Do you know how many people are taking your drug? No, you can't count. So we don't know the number of people in phase 4 trial. Fine. Next point. Phase 1 trial, healthy human. Agreed? Phase 2, patient, patient, patient. So which phase of clinical trial is done in healthy human? That is phase 1. Design of a trial, unblinded. No blinding is there. Phase 2, RCT with blinding. RCT with blinding. Now you know what is RCT? RCT means randomized control trial. In RCT, here we will test our drug. In one group of patient, I will give my test drug. In another group of patient, I will give my placebo. Why we give placebo? To maintain blinding. While in phase 3, in one group of patient, I will give my test drug. And another group of patient, I will give the gold standard treatment which is already available in the market. And I want to check whether my test drug is better than the already available treatment in the market. I hope it's perfectly fine. And lastly, unblinded. So MCQ, which phase of clinical trial are RCT and blinding? Phase 2 and phase 3. Remember an MCQ. Purpose. Phase 1, see the name, human safety and pharmacology trial. So we check safety of a drug and we check the safety limit at MTD, maximum tolerable dose. And we also check pharmacokinetics of the drug. Name itself is telling you. Phase 2 trial, therapeutic. Therapeutic means beneficial effect. So we will determine efficacy. Exploratory. So we will check whether the drug is efficacious, yes or no. And if we find the drug to be efficacious, we will get proof that yes, our drug works. So this is known as proof of concept trial. Agreed? Phase 3. Again, therapeutic word is coming. Therapeutic means beneficial effect or efficacy. So here we will determine what is the actual dose our drug is found to be effective as compared to gold standard treatment. So we will determine the actual dose of a drug which should be given in our patient. My question from you student is, can you tell me among 1, 2 and 3, which phase of clinical trial would you like to label as comparative efficacy trial? Tell me, comparative efficacy trial. You are comparing an efficacy with some other thing. Comparative efficacy trial is phase 3 because you are comparing the beneficial effect of a drug, efficacy of a drug with the gold standard treatment. So these are the other name. And after phase 3, when you have confirmed the efficacy, actual dose of a drug, the drug comes into market after phase 3 trial. And after market approval of a drug, we will keep on checking the safety of a drug to find rare or missed side effect in phase 1, 2 and 3. And if the drug is found to be harmful, we withdraw the drug from the market. A drug gets banned in which phase of clinical trial? Phase 4. So remember, to make a drug ban, first let it approve. It gets approved after phase 3. It comes in phase 4. So drug gets banned in phase 4 trial. Good. Which phase of clinical trial? Now tell me the answer very fast. RCT with blinding. RCT with blinding is phase 2 and phase 3. So the answer is phase 3. Next, phase 4 clinical trial are carried out in after the drug has been marketed. I hope now it's easy for you to understand. Easy for you to understand. You will never forget the story I have told you. Next is false about essential drug. Remember, essential drugs are given for highly prevalent disease like diabetes, hypertension, which are common disease in our country. So don't you think these drugs must be available in all type of formulation? Like for children's syrup, for old age, we should have tablets, syrups, etc. injection. Remember, they must be cheap or cost effective, and don't combine essential drug with other drug. Because if you will combine them with other drug, which is known as FDC, it will unnecessarily increase the price of a drug. So don't combine essential drug with other drugs. So this is a false statement. They should never be combined. Okay. Next we have is drug used for rare disease. Remember, rare means this disease does not have his mother and father. That means drug. So the answer is orphan drug. Remember one example which was asked last year is D-ferrioxamine. Remember, Fe word is coming. It is an iron chelator, but not just iron chelator. Any chelator given for metal poisoning. Metal poisoning are very rare disease. Their drug are known as orphan drug. Placebo is known as dummy drug, which contains inactive chemical. It does not contain any active ingredient used in clinical trial to maintain blinding in RCT, which we have discussed. Counterfeit drug are illegal drug which are made with an intention to cheat. Essential drug we have already discussed. Let's talk about this counterfeit drug in great detail. Remember, there are three types of counterfeit drug: misbranded, spurious and adulterated. Three types. Now you went to a chemist, you asked for a paracetamol tablet. When you ask for a paracetamol tablet, he gave you 500 milligram paracetamol which you asked. But when you tested this drug, it only contained 200 milligram of paracetamol. This is known as misbranded. This is known as misbranded. Misbranded are also known as substandard drug. They are also known as substandard drug. Spurious means when you tested this molecule, it contained no paracetamol. This is known as spurious. Spurious has one more name. Spurious is also known as falsified drug. It is also known as falsified drug. Name itself is telling you. Adulterated means addition of harmful excipient, some addition of some harmful chemical is adulterated. In Hindi, you can call it as milavat. Okay. Which of the following is Schedule X drug? This question was asked 2 or 3 years back in NEET exam. Most of the students, they marked the answer wrong, incorrect. Anyone who can tell me? Anyone who can tell me? I'm waiting for your answers. I hope you will mark the correct answer. Yes, I'm waiting for your answer. Yes, the answer is not A. No, it is ketamine. Now remember, thalidomide, enalapril, valproate, they are teratogenic drug. They are teratogenic drug. And teratogenic drug are known as category X drug. It is known as category X drug. The question has been asking you about Schedule X drug. Ketamine is a Schedule X drug. Schedule X drug means narcotic and psychotropic drug. That means the drug which have addictive potential. Addictive potential is there. This is known as Schedule X drug. So ketamine is addictive. Okay. Ketamine is addictive. Yes, it's a narcotic drug. So prescription drugs are included in. So this was a question of this year INICET May exam. It's a very simple question. So likelihood it might be repeated this year. And this question was asked last year in NEET exam as well. So Schedule Z. Can we say Z for zebra, which we learned in nursery? So Schedule Z drug are veterinary drug. Veterinary drug means the drugs which are used in animals. Schedule G. G means which are given under medical supervision. That means only a doctor or a nurse will give the drug to the patient. Let's take an example. Can patient himself or herself can take a vaccine? Let's say the option was having HBV vaccine. Can a patient himself or herself can take vaccine? No. So those drugs which are given under medical supervision are G. G for given. Example vaccine. X beta we have already written. X is always addictive. X is always addictive. That means addictive drug, narcotic and psychotropic drug. So remember two mnemonic, two examples. One is ketamine, which has been asked, and a very addictive drug, morphine. Fine. Now remember Schedule H. They are known as prescription drug. And this year the question asks you about example of a prescription drug. Obviously insulin. Insulin patient himself or herself can take at home. Agreed? So it will not come under Schedule Z drug. Agreed? Insulin is non-addictive, non-narcotic. It will not come under Schedule X. Insulin is used in humans. So H for humans you can remember. Okay. So next is pharmacovigilance. Vigilance means to keep check on something so that a person should not do any bad thing. A drug can do bad thing, and that bad thing caused by a drug is known as ADR. ADR means adverse drug reaction. So pharmacovigilance means to keep check or monitor the adverse drug reaction of a drug. So remember, monitoring of drug safety and ADR is pharmacovigilance. Now type B ADR. ADR are of different type. Remember those adverse drug reaction which are seen at very high dose. Like hypoglycemia due to insulin. It will occur in high dose. They come under type A ADR. Those ADR which can occur at any dose, low dose, medium dose, high dose, they are known as type B ADR. And type B ADR, because they are idiopathic, they can occur at any dose. We call them as idiosyncratic reaction. So the answer of this question is B. Due to chronic use of a drug, type C ADR. Due to delayed effect of a drug, type D ADR. So you don't have to go into the detail of C and D. Most of the time the question will come in type A ADR or type B ADR only. So this finishes our general pharma. We will meet again most likely tomorrow. I'll post the live link of the video on my Telegram channel. PDF will be posted within half an hour, 30 minutes. Let me have a little bit of water. I'll modify the PDF. Okay. I'll post it on Telegram group. Don't worry, for the next 30 minutes. After 30 minutes or within 30 minutes, the PDF will be posted. Meanwhile, you can join, you can share this video with your friends who are in need of learning pharmacology. They are out of time. So let them help also. Okay. Chalo. It was indeed a pleasure interacting with you. Thank you very much. So we will meet tomorrow, and tomorrow we will start with autonomic nervous system, and I will take respiratory system also. So I'll take 2 units tomorrow most likely, so that before your exam, especially NEET and FMG exam, we will try to finish as much as possible. Okay. Thank you very much. I'll post beta everything. Don't worry. Relax. Don't have anxiety for tomorrow. Okay. Relax. Okay. Chalo. Best wishes. Ending our session. Keep learning. Thank you.